Not every birth defect is associated with something we can do to prevent it, but those we can prevent, we should. The dictionary definition of a teratogen is any environmental agent that can cause abnormalities in a developing organism resulting in either fetal death or congenital abnormality. Common examples include alcohol, antibiotics, antidepressants, cigarettes, and cocaine. However, teratogens are not limited to just these, as many objects we use every day may contain chemicals that could have detrimental effects on an embryo. The word teratogen stems from the word terata from Aristotle's natural slavery argument. Aristotle interpreted terata as the result of forces upsetting reproduction from its natural development. This led to the term teratology, the study of abnormalities in all organisms. There are many adverse effects of teratogens. They often result in severe central nervous system damage, as well as difficulties and complications within a child's physical development. Severity of abnormalities are dependent on susceptibilities carried by the mother and the fetus. The effects of teratogens on the fetus include fetal alcohol syndrome, stillbirth, sudden infant death syndrome, premature delivery, low birth weight, heart defects, behavioral problems, and relatively low IQs, just to name a few of the most prominent. There are two main classifications of teratogens. The first is environmental. Environmental teratogens are most responsible for causing an increase in the risk of cancer in a fetus. Some of these include infectious diseases such as HIV, AIDS, or the flu, excessive heat, radiation, and pollution. The second and most common type of teratogens are physical agents. These include alcohol, Accutane, cigarettes, antibiotics, antidepressants, and drugs of any kind. The most common and one of the most dangerous of these are cigarettes. Physical agents can cause diseases in many body systems, such as abnormalities in the reproductive system, including micropenis in males, infertility, late puberty, endometriosis, Stein-Leventhal syndrome, and prostate cancer. They can also cause difficulties in the nervous system, such as multiple sclerosis, neurotoxicity, brain cancer, central nervous system disease, demyelinating disease, Parkinson's disease, and early dementia, and the circulatory system, which includes complications including heart disease, high blood pressure, heart attacks, strokes, abdominal aortic aneurysms, and peripheral artery disease. Would you want to risk increasing your future child's chance of having any of these diseases for something as simple as a cigarette? I know I wouldn't. Oftentimes, parents will make choices that could harm their future baby without them even knowing it. These choices could lead to anything as minor as an illness or something as severe as death. However, these situations can be prevented through educating those whose children are susceptible to teratogens, as education is the most effective form of prevention. Unfortunately, not all teratogens can be prevented. For some, the damage has already been done. We, as a species, owe it to those affected to provide support and assist in making their lives easier. Through proper therapy and emotional guidance, the people affected by teratogens can lead a normal and prosperous life. Because the amount of substances in the world that could affect a fetus are so vast and common, it is nearly impossible to completely inhibit teratogens from influencing a fetus. However, through educating others, we can greatly decrease the number of children born with birth defects and limit the overall impact teratogens have on the human race and make the future easier for those whose lives have already been altered by teratogens.